morning all. Good morning. So today we are going to discuss about PIC microcontroller in design thinking approach. So basically PIC is a peripheral interface controller and it was developed by General Computers in the year 1992. So similar to microcontroller, how we could be programmed and control variety of application, here the same PIC microcontroller could also be programmed and could be used for a number of application. And today we are going to see one of the application of PIC microcontroller in health monitoring system based on design thinking approach. So as we know that design thinking approach has 5 stages that starts with empathize, define, ideate, prototype and testing. So let's have a discussion on this.
Going to discuss about the empathize part. So empathize part, the PIC microcontroller is very useful. So it is used for the like patients, like elder patients or chronic patients in rural areas. So next one is it is the uses of like patients or like nurses or doctors are especially, and it is developed in the embedded systems. So what does the user needs and their challenges means? It is if the person patients are in long distance, so they can't take the daily checkups. So this is the one of the challenges and needs for the users, and it is used by digital like this microcontrol. So these are the user needs and the challenges in this.
So I am going to explain the second stage in the design thinking part. In this stage, we have to clearly articulate the problem we want to solve through our ideas. So the elder peoples in are individuals in rural areas were affected by chronic conditions. So the limited resources have the, which have handled is not handled by their medical caretakers. So in this, the existing systems were costly and bulkier and power hungry. So with the help of big microcontroller, how might we create a reliable, efficient, and which will be operatable by everyone, which it would not contain any technical expertise. So it can be operated by everyone. So in this stage, uh, we have to create the um, monitoring system with the efficient power um,
And then coming to the immediate part, especially in the health monitoring areas, we use feed microcontrollers, such as model named as 16 or 32. Mainly, we go for this big microcontrollers is because of its one of its major advantage, that is low power processing. And then after choosing the microcontroller, of course we have to add sensors. So by use cases, we attach external sensors such as temperature sensor, oxygen level sensor, pressure sensor, etc. And then we also attach GSM module. So mainly GSM module is used for sending SMS without any internet. And then again coming to the specifications, we can use external LED or OLED displays for remote virtual monetization. And then we go for low power rechargeable batteries so that the entire system could work without any modules.
So coming to the next part, that is the prototype. So for this prototype, just like Nitin told, we have to be using a set of components which should be reliable and cost effective too. So for that, we'll be using the microcontroller, that is PIC 32MS. And the next up, we'll be using sensors like temperature sensor. For that, we'll be using LM35 sensor. And after that, we'll be using the GSM module. And next time, we'll be having the LED displays and of course the power supply. So when we all connect all these together, first off, the sensors, that is, we'll be using the LM35 sensor and as well as the pulse oximeter, that is MAX 30100 sensor. So that MAX 30100 sensor, which actually gets the pulse from the body, and with the temperature sensor, that's LM32, gets the temperature from body, and it sends the data to the PIC microcontroller, which acts as the brain, which controls and detects the data out of the sensors. So we'll be fixing a particular temperature and the pulse value itself. So when that exceeds or when it is too low, the GSM module will actually detect it and it will send the messages without any internet, just like the window. So when we connect all these together, it will be displayed in the LED monitors, and using other softwares we can also track the history also. So for this we'll be using the power supply. So when we connect all these together, we'll get a perfect system for the health monitoring using the PIC microcontroller. This would be a good prototype.
And the final part, testing. Actually, testing which helps the people to work on it and find any queries or clarify all those things. So we deploy the small health monitor systems in a small rural clinic or house or the patient's respective house. So on that we observe how it works. So from that we are using, as she says, we are using few sensors which helps to measure the temperatures, heart rate, oxygen levels, etc. So from that we just need to measure how fast is the readings are carried out. Whereas how it will help the people really convenient or comfortable to them. And also GSM alerts will send the messages when it is crossed, the vital signal cross the danger line. And based on the real world examples, which will help to, it's really easy to use, the battery is really reliable, and also it is cost effective and convenient to use for the workers.
Very good discussion on this topic, PIC microcontroller and how it is being suited for the health monitoring system. So based on how we define the patient history and how we are going to track the temperature and find out any changes, bodily changes that could be easily tracked using and communicated to either doctor or to the patient relatives as such. So this is how effectively we plan together based on the DT approach. We could able to find a result or solution for any possible cases, right? Yes. So I hope this was a very good session that we had and regarding this PIC microcontroller application. Thank you.
Thank you.